and welcome to this new podcast of the American Journal of Public Health. I'm here in Minneapolis at the annual meeting of the American Public Health Association, and with my co-host Vicki Mays, we have looked carefully at the program and have identified, presentations and roundtables and posters that were on topics that are important for public health, but that are rarely covered in the journal or in our podcast. And today, I have the privilege to be with Yi-Ling Tan, who has been working on the question of problem gambling in the Asian community. Yi-Ling, this is a very interesting topic, and frankly, I didn't know about that it was something that people were talking about. So tell me, first of all, who are you, Yi-Ling Tan?
Thank you, Dr. Morabia, and it's such an honor to be here today. So I am part of NYU Grossman School of Medicine. I am a program manager in the Department of Population Health, Section for Health Equity, and I'm really proud to be working at the Center for the Study of Asian American Health. We have been working to reduce health disparities in the Asian American and immigrant communities since our existence. And problem gambling was something that came to our attention quite recently, actually, and it was something that was highlighted by our community partners.
And so tell us now, what's the problem with gambling? Why do we call it problem gambling?
We are concerned not about gambling as, a fun activity that you do at home or with your friends, but with gambling disorders, gambling addiction. It has been associated with great financial harm and disruptions to family life and personal lives. And it is, of all the disorders, addictive disorders, it has the highest rate of suicide. So it is a real problem. It's not even thought of as an actual disorder. And so there's been very little resources and research done on problem gambling in general, not to mention problem gambling among specific populations.
But do we know that Asian Americans have higher rates of suicide?
We don't have the specific data. In fact, I hope to really highlight the fact that there's actually not a lot of research and data on Asian Americans in problem gambling at all. That's something we're hoping to change. But what we do know is that Chinese Americans, for example, have the least help-seeking behavior for mental health of any ethnic subgroup. And so, there are a lot of inferences that we can draw from previous research and from looking at other mental health issues that we're extrapolating to this issue. The licenses are not going to be granted till 2026, so we have a little bit of time before the casinos come to New York. And so what we're really hoping to do is highlight this issue and get resources and funding and data, in place, and appropriate education and treatment programs in place before the casinos come to New York.
That's really a public health preventive approach to the problem, which I really like. What is there about problem gambling? Why specific for this community and not for every community? Is it a specific problem of the Asian community?
It has been associated with the Asian American community, yes. And why now in particular is because the New York State legislature has recently approved the award of 3 casino licenses in downstate New York. The New York City metropolitan area is expected to be one of the largest untapped sources of revenue for the gaming industry in the US, perhaps even more than in Las Vegas. So as you can imagine, there is a lot of interest in setting up and developing a casino in the New York City area. I think there has been 11, maybe 12 bids kind of proposed so far in the New York City area, all whom are within 10 miles of a significant Asian American population. So they are planning to award these licenses sometime in 2026, which is why our community partners are sounding the alarm right now. We are anticipating that there might be an increase in problem gambling in the Asian American population. As you were asking, why this particular population? There has been a history in the gaming industry of targeting Asian Americans. You know, I was doing a poster session just now, and so many people walked up to me and said, well, you know, like go into a casino and you see almost everyone there's Asian. And there's, I guess, there's a stereotype that there's a cultural association between people of Asian descent and gambling. And what we're trying to highlight here is that we see problem gambling, which is defined as gambling addiction, is in the DSM as a gambling disorder. We see problem gambling as a public health issue. It's not a cultural or individual issue, which is what I think the perception that a lot of people have, and that's what we were trying with our poster to really highlight. You know, there's a big difference between the games that, you know, I play at home, you know, during cultural events like Lunar New Year, you know, playing mahjong with friends or cards with my family. And that's very different from the casino industry targeting Asian Americans.
I have two questions, since we're talking about problem gambling as a public health. First of all, I'm surprised that it's a problem of Asian American, because Asia is so big. I mean, there are Chinese and Japanese and Korean and Singaporean, and so how does it affect all Asian Americans?
One of the things that we found during this process was that there's actually really limited data on problem gambling in Asian American communities. In national surveys done in the US, you know, Asian Americans are not a very significant sample size, and a lot of surveys are conducted in English. But why we're focusing on Asian Americans is that the casinos are focusing on Asian Americans. If you look at the gaming industry's marketing strategies, it's very focused on Asian Americans. They have buses that, you know, originate in Asian American neighborhoods.
But in Chinese, in Japanese, in
yes.
So in what? In all the languages?
In multiple languages.
I see.
I'm speaking about the context that I am most familiar with is New York, where there is a very large Asian American population. In fact, New York City has the largest Asian American population in an urban area in the US, and Chinese Americans comprise over half the Asian American population in New York. Hence our focus on Chinese Americans in particular, but there are many other Asian American subgroups that are also targeted or being targeted by the gaming industry.
But incidentally, I was in China in July, and they insist that, you know, in New York is more Cantonese, in other parts they come from other places, and so they make difference even from among the Chinese origins. So there's a need for disaggregation there.
Totally. No,
Okay.
I'm so glad you brought that up. And even in New York, based on your immigration wave, you know, you see like Cantonese speakers in older, maybe older Asian American adults. But in the more recent waves of immigration from China, you might see Fujianese speaking folks or Taishanese speaking folks. And that's very unique to New York. I know that in California, for example, that reflects a whole, you know, there are different immigration histories there. And so people speak different languages there. But, you know, the gaming industry focus on Asian Americans.
I got it.
Yeah.
But maybe indeed we need more data, and that's why your project is important. Do you involve the Asian American communities and the organization in your project?
definitely, we can't do it without them. And in fact, they are the ones really leading this. I must confess that, my work isn't really in problem gambling, but we do have a long history of collaboration with our partners, with our community partners in Chinatown, for example, in the Asian American communities in New York City. And they were the ones who brought this to our attention. I wanted to give a shout out to our longtime partner, Hamilton Madison House. It's a settlement house in New York City with the largest behavioral health program serving Asian Americans on the East Coast. They're really seeing a dramatic rise in caseloads in their mental health clinics, after the pandemic and with the rise of anti-Asian hate. And they're very concerned about the impact of the casinos on the Asian American communities, given that there's not really a lot of culturally and linguistically appropriate treatment out there. And so they reached out to us and wanted our collaboration in really looking at their academic published data on problem gambling and in the Asian American population in general, while they provide the clinical expertise and background. And so together, we then brought all of these issues up, all of these concerns up to our policymakers. Earlier this year, actually, we had a roundtable discussion with State Senator John Liu and Assembly Member Grace Lee, and talked about some of the issues and some of the mitigation strategies that we're hoping they would be able to put in place.
Great. I think that's a fabulous project, and I'd like to know what happens and until 2026 and what you are able to put in place. So I hope you'll have follow-ups in the coming annual meetings.
Thank you. We're really hoping to do this, and we have a great partnership in place, and so I'm very hopeful that we'll be able to get the resources and the research and in place before 2026.
Thank you, Yi-Ling. Thank you for your time and for this really great contribution. You can be very proud of this work. So thank you, everybody. Thank you for following us on this podcast of AJPH. Today, I was really privileged to have Yi-Ling Tan with me and to talk about the issue of how to handle potential, I would say, problem gambling in the Asian American community of New York in the time where they plan to build several casinos and open them in 2026 in New York State. Thank you for being with us, and bye-bye from Minneapolis.